nowadays the calcium score, coronary calcium score has become a buzzword across the globe and the medical fraternity and even amongst the people. So, this is a new concept where the blood calcium is entirely different from the calcium that is deposited in the coronary blood vessels. So, this has become a very important diagnostic tool, though it was first identified or pointed out in 1990s. Somehow there has been an inordinate delay to identify that this is the best diagnostic tool compared to the other investigative tools like risk factor stratification and stress tests. The calcium score of the coronary arteries means there is already cholesterol deposition in the coronary arteries. Part of the cholesterol deposit gets converted into calcium. That means, without doing invasive or cath angiogram, without guessing, which we have been doing based on the stress tests, we are directly peeping into the coronary arteries. That means, when you see a calcium speck in one of the coronary blood vessels, yes, that means this patient is having atherosclerotic or cholesterol plaque, which is likely to cause problem in the coming few years. Now, with this calcium score, especially when it is present in young patients like between 30 to 50 years, especially when it is present in females, that is supposed to have more dangers in future and more prediction that they may have some events in the coming few years. So, immediate action has to be taken, and compared to the current trend wherein we start statins or other drugs after a heart attack, that means after the age of 55 or 60, now we are planning to start, or the trend or the recommendation based on the scientific ground is to start statins by identifying calcium specks, calcium score or atherosclerotic plaques in the earlier stage. This way you can cause regression of the plaques, you can prevent the progression, and also you can predict the events so that appropriate treatment can be given, and you can postpone the event for 5, 10 or 15 years, and when the event is there you can act quickly because you know that some disease is there.